My name is Nils Daulaire. I joined the Global Health Council, then the National Council for International Health, when it was celebrating its fifth anniversary. So I've been connected with the council for 45 years. I was the president, actually, I was the chair of the annual conference for the 25th anniversary. And then starting the next year, I was the president and CEO of the Global Health Council for 10 years, from 1998 to early 2009. Oh, I think that the attention that was devoted to global health through the the first decade of the 2000s, the Global Health Council had a lot to do with that. I mean, none of this was unitary work because the council has always been a membership organization. But being able to pull from the really vast array of kinds of members and organizations that are part of the Global Health Council really gave us a strong footing in terms of our advocacy for increased resources for global health. So I think looking back on it, that was something of a golden age for global health support. Well, I think one of the contributions that started at the very beginning and is still ongoing is the fact that it really is an open forum for all of the key players and stakeholders in global health. And you don't need to be a big and important organization or a world famous researcher to be an active part of the Global Health Council. And so it really serves as a voice and an amplifier for people who are trying to make a real difference in the place where people live. Well, I think again, being able to pull together a diverse constituency, the Global Health Council is known as not being a self-interested organization. A lot of advocacy and lobbying in Washington is really aimed at improving the standing of the organization that's doing the lobbying. And in the case of the Global Health Council, I think it's seen as an honest broker, as a way of getting people with knowledge and experience to the table, and policymakers listen to that. Well, one of the challenges during my tenure at the Global Health Council, and I'm sure it continues to be a challenge, is that the more successful the Global Health Council is at being effective but invisible, the better the results for our members are. But because it's largely invisible in some of its most active advocacy and policy assistance, sometimes members say, well, we've got these resources, they seem to have magically appeared, but we don't really need to have go through being a member of the Global Health Council and so forth. So there's always a centripetal force sort of pulling the membership away into their own particular sub-interests. And what it really needs, and I think we're getting it from the leadership of the Global Health Council currently, is a constant reminder that we really are going to do better across the board in global health by working together. I think there has been a significant dispersion of attention in terms of global health, and I think that there's an opportunity here to bring the core back together. Right now, we've got certainly a big initiative in terms of COVID-19 and the world's response to that, the non-communicable diseases rising, the issues of the decolonization of the leadership of global health. All of these are important but very disparate things, and having a voice where these issues can be discussed and priority set, I think is going to be really important. I think the council provides a very meaningful counterweight to some of the official bodies and to some of the very big funding organizations. It really does represent the people who are trying to get things done in the field, and I think that really matters.